Good Monday morning, Facebook family. Again, sitting here at my breakfast table with so many community partners here. This is Pop Barnes Health and Community Tip for the Weekend. Yes, we come on every Monday morning. We won't be on next Monday because it's a holiday. Dr. Martin Luther King Jr., thank God for him, the Lord blessing him to our country. It's just a marvelous thing. So as always happens, somebody calls me on my phone, so excuse me while I disconnect that and turn it down a little bit. That's what you call time. It's Murphy's Law. And this program, the germ of this program is to provide. The Bible says my people perish for lack of knowledge. And so we wanted to give you each week enough health information that you can make healthy, start a healthy lifestyle or make informed healthcare decisions. And then that's the health part, and to live a long quality of life with your loved ones. Everybody wants that. And so we decided to do this program. And then the community tips is just good information for you to know. And as always, I'm joined this week by my community partners. Everybody knows the lady with the glasses, Miss Susan Gallagher, New Horizons Behavioral Health, Dr. Nikita Pitts, the Tree of Life Healthcare, representing Dr. Laurel Clyett. And we have our special guest. So I'm going to pass the baton to Dr. Pitts this morning and ask Dr. Pitts to say a little bit about herself, what organization she represents, the hours of operation, of the brick and mortar, and the phone number, so that y'all can take advantage of the good services of that organization. Dr. Pitts?
Hey. Good morning, everyone. Can you hear me all right?
Yes, we can.
Okay. Well, I'm representing Tree of Life Healthcare Clinic. We're located at 1968 North Avenue in Columbus. We are across the street from the Columbus Research Institute and really also the parking lot of Piedmont Hospital. We offer services and actually have a correction. It's Monday through Thursday from 9 o'clock to 3 p.m. And we are closed on Fridays. Saturdays is the second Saturday of every month from 8 a.m. to 1 p.m. Okay, and so we're a faith-based organization serving people who are uninsured or maybe underinsured, and we make referrals through, or rather whatever the client might need. We are able to make referrals, but we're there, almost every day. And again, I'm representing Dr. Clyett. So it's good to be here. Thank you.
And everybody knows her renown, her fame, the executive producer, Miss Susan Gallagher, known as the lady with the glasses.
The lady with the glasses. Good morning, Facebook family and friends. I hope you are enjoying this wonderful Monday weather we're having today. New Horizons Behavioral Health, I send greetings from our executive director, Miss Andrea Winston, our CEO. She's not able to be on this morning, but she's with us in spirit. New Horizons Behavioral Health, we serve the mental health, substance abuse, and adult developmental disability needs for an 8-county area in West Central Georgia. Our phone number is 706-596-5500. We have locations throughout the 8 counties that we serve. And during the COVID pandemic, a lot of our services are being offered through telehealth. So don't let your fear of the COVID pandemic keep you from reaching out for your mental health or addictive disease needs. We do offer telehealth services during the COVID pandemic. And again, our main appointment line number is 706-596-5500. Our main clinics and outpatient programs are open Monday through Fridays, 8 a.m. to 5 p.m. Some of our programs operate in the evenings. Our residential programs are staffed 24/7, 365 days a year. So reach out to New Horizons for your behavioral health care needs. Thank you.
And as I always say, Facebook family, long ago I partnered with these 2 organizations because these organizations are here to provide mental health and physical health for you, for your needs. You've heard Dr. Pitts say that serving the individuals who have no health insurance or underinsured. But in that same token, I always like to encourage our community. For organizations like these two here that do so much for the community, help the community, then we need to help them. And we all know that any organization would welcome volunteers, because volunteers are what makes the organizations go. They help the organizations fiscally, but also at the same time, they always have to have that little crinkly green stuff with our presidents on it. And you want to know something? My daughter that's in Nashville, Tennessee, she said, "Dad, you always talk about that green crinkly stuff. So everybody knows that's money." I said, "Yes," I said, but I like to describe it. It's money, and because no organization can continue to provide care for you when you need it without some type of help, volunteer, or money. And let me just tell you something. I always tell individuals, everybody knows in the Bible the story of the widow's mite. So therefore, no amount of money is too small. It's whatever your heart tells you to give and you're able to give. And so I would like to encourage all of y'all to think about the organizations that really do so much for you. And we have a special guest, as we have every week. And we have Miss Cheryl Johnson. She coined the term that we use on this show, entertainment. Because she said, "Pops, you want to know something? You give good information, but y'all be cutting up down that program too. So you be giving good information and laughing and joking. Lady with the glasses, Dr. Pitts. We're having fun, but we're giving you the information out of the goodness of our heart because we want you to have a long, healthy life with your loved ones and to know in the community what things you need to do." And so I'm going to introduce Ms. Cheryl Johnson. She's the president and CEO, West Cancer Georgia's Cancer Coalition, where she can say where she's at, how you can reach her. And on the, let me think now, on the second, we have the Cancer Coalition coming every second Monday of the month because we want to calm people, let people know that cancer is not a death sentence, but also where you can go, what services, and your support that you need. So I'm going to ask Ms. Cheryl Johnson to talk about the West Central Georgia Cancer Coalition. And after she does that, we're going to start into her marvelous presentation on cervical cancer. Cheryl?
Well, good morning, good morning, good morning. It is such a pleasure to be here with you, Pops, and our guest, not the guest, but the other collaborators. And I am Cheryl Johnson with the West Central Georgia Cancer Coalition. I am the CEO, have been here for 13 years now. February will be 13 years. It doesn't seem like it, but it's been a great, great, great journey. The West Central Georgia Cancer Coalition, we are truly a community collaborative. We work with the entities such as Tree of Life, such as New Horizons, the healthcare, the hospitals, the other entities that are here. And we want to be that missing link, that link to provide the resources to those persons who are uninsured and underinsured. We provide screenings for breast, cervical, prostate, colorectal. Those are the cancers that we really focus on in regards to finding resources for those persons who are uninsured and underinsured. They do have to have referrals, and that's why we work directly with the healthcare providers in our community. And with that being said, this month is Cervical Cancer Awareness Month. And so we'll be talking more about that. But if anyone would like our services, we have a website. They can go on our website, and I'll show that in the presentation. And our phone number, 706-660-9516. It's on the presentation as well. But I'm just excited to continue to be a servant to this community because this is truly a ministry here in our area.
And much needed to Cheryl. We just thank you for the 13 years that you've been here. And the one thing that is done just through organizations like yours and through research, it doesn't, the word cancer does not strike fear in people like you. When I was coming up, that's the word that people say, got cancer, got cancer. They would whisper it. And Susan, what's that word that you use that where you can speak about things? What's that terminology? You came up with a terminology, something that says that people can be open because more education is about it.
Right. Just because you don't talk about it doesn't mean it's not going to go away. We have to bring things into the light for us to shine awareness on them. So it's shining a light, putting the spotlight on things.
And your organization, Cheryl, has done that, where people used to be so afraid, they were afraid to even go find out if they had, even though they felt that they had the signs.
Absolutely.
So your organization, right, and your organization has opened up the door so that the fear is not into the individuals. And I have to. My cousin Moya Lindsay from Philadelphia is watching the program. She just said, "Good morning, cousin Jerry and ladies." So this program reaches so many people that it just warms my heart that we're doing this, because it's all my 5,000 Facebook friends plus the public plus YouTube. And so now, sure, we're gonna give all this good this education, this edutainment that you have presented for us.
Edutainment. Okay, let me get started with this cervical cancer awareness. And also there is a program that we will be sponsoring along with several other community partners. It's an HPV awareness for mothers and daughters or guardians and their girls. It's a girls only event, and we're going to come back in the spring. We're going to come back in the spring and have one for the boys as well. But this is January 21st, and we'll talk a little bit more about that once we educate everyone about cervical cancer. So I'm going to share my screen now.
All righty.
Let's see. And just want to welcome everyone. As I said earlier, this is the month of Cervical Cancer Awareness Month, and we know there's so many women that are out there that have experienced this particular illness, but it's not a death sentence, as Pop said. But I would like to just share, and my particular slides, they do have a lot of verbiage in there, but this is because I like for people to go back later and take a look at it, and they're able to view it. But we know that cancer, it's a disease where the cells are in the body and they just grow out of control, and it's named in whatever part of the body that it starts in. So if it spreads to other parts later. But when it starts in the cervix, this is why we call it cervical cancer. The cervix connects the vaginal birth canal to the upper part of the uterus, and the uterus is where the baby grows. And we have all adults in here, and there may be some mothers on here, so you're very familiar with what we're talking about. And for those who aren't mothers, they still, as a woman, you should know what is part of your body, what's normal and what's abnormal. We'll talk a little bit more about that. But all women are at risk of cervical cancer because all women have a cervix, and it occurs most often in women that are over 30. There are long-lasting infections with certain types of the HPV is what actually is one of the main causes of cervical cancer. And it is a common virus that's passed from person to person. Most of the time it's sexually active people at some point in their lives, but women can get cervical cancer from HPV. It is highly preventable in what we call the Western countries because we have screening tests and there are vaccines to prevent HPV infections. And when cervical cancer is found early, it is very highly treatable, and it's associated with long survival and good quality of life. The next screen is just a diagram of the different part of a woman's reproductive system. You had a question, Pop?
I was just saying, organizations like your organization showing what you're showing now and giving the facts is what's really increasing the longevity, because people are more educated and they will recognize symptoms.
Yes, and we're going to talk about risk factors. We'll talk about screening tests, the vaccine, and so forth. And so, as you can tell, the cervix is where the cervical cancer will begin. These are some of the risk factors. Almost all of the cancers are caused by HPV, and there are other things that can increase your risk. HPV, as we said, is a very common virus that can be passed from person to person during intercourse, sexual intercourse, and there are many types of HPV. Some types can cause changes just in the woman's cervix that can lead to cervical cancer over time, while others can cause genital warts or skin warts. HPV is so common that most people get it at some time in their lives, but it can go away, and it usually has no symptoms, so you can't tell that you have it. For most women, it will go away, as I said, on its own. However, if it does not, there is a chance that over time it can cause cervical cancer. These are some other things that can increase the risk. Having HIV or another condition that makes it hard. Smoking is another risk factor. Using birth controls for a long period of time, having given birth to 3 or more children, and I can't stress this enough, having several sexual partners. There's 2 screening tests that can help prevent cervical cancer, and for all the women that know the dreaded Pap test, we, you know how the men dread going and getting their prostate screening.
Yes,
women do dread this. It's not one of those things that we look forward to, but we do look forward to finding out if there are any precancers or if there are any cell changes. And so I cannot stress it enough for women and young women to please go and get your Pap test, your Pap smear done, to have the HPV test looking for the virus that can cause these cells. Both of these tests can be done in the doctor's office or a clinic. And if you're low income, the health and don't have health insurance, we can get referrals to get you to the right clinician to get this done if you qualify. Regarding the HPV vaccine, it protects against the types of HPV that most often cause cervical, vaginal, and vulvar cancers. Now, these are recommendations that come from the CDC, so the information that's shared, and I'll show you the resources later, but it is based on CDC recommendation for preteens age 11 to 12, but can be given starting at age 9. This has been a lot, there's been a lot of controversy about that, and what I say is parents, mothers, fathers, this should be discussed among the family, and you all make that decision. The HPV vaccine is recommended for everyone through age 26 if they have not already been vaccinated. It's not recommended for everyone older than age 26. However, there are some adults aged 27 through 45 who are not already vaccinated who may decide to get the HPV vaccine after talking with their doctor about their risk for the new HPV infections and the possible benefits. With all of this, we cannot stress enough, know your body and talk with your healthcare provider. If vaccination is started before age 15, there is a 2-dose schedule is recommended when the dose is given to 6 to 12 months apart. And then for people who start their series after their 15th birthday, it's given in a series of 3 shots. It prevents new HPV infections, but it does not treat existing infections or diseases. This is why the vaccine works best when given before any type of exposure, and so that's why it's recommended for those younger women in the very beginning. You should get screened for cervical cancer regularly, even if you have received an HPV vaccine, and that's for those older women. Again, other steps to help prevent. Things to lower your risk for cervical cancer. Smoking, and we know smoking causes so many other illnesses. Yes. It prevents you from healing properly. It prevents, it increases heart attacks. There's just so many things. So we cannot stress enough about, if you're smoking, to stop smoking or don't start. Using condoms during sex. Now, of course, limiting your number of sex partners. And there's a note here that the HPV infection can occur in both male and female genital areas that are covered or protected, but there's also some areas that are not covered, so that will not prevent you from getting that genital warts. So it's really, really, really important to know your body, to know and limit the number of partners.
And Cheryl, if I could just stop for a minute, I am so glad that you are giving everyone the signs and symptoms, but also the prevention. Like you were talking about prostate cancer. Men hate to have that, but I encourage that the biggest thing is screening, and speaking to your healthcare professional. The second thing is organizations like yours that gives out information like this here. I'm learning some things here myself. And so this is excellent. And again, thank you. And I just wanted to, my spirit just asked me just to say thank you that you are providing this information that the average person can relate to and understand.
Right. And thank you for, again, this opportunity to share with our adult audience, because we know that the kids should be at school, but this is also an opportunity for the adults to talk with their children, about these things, or about the with the young ladies. So let's talk about some of the symptoms. Early on, as I said, cervical cancer may not cause signs and symptoms. But if there is an advanced cervical cancer, there may be bleeding or discharge from the vagina that's not normal for you, such as bleeding after sex. If any of these signs, or you see any of these things that's not normal, I cannot stress enough, ladies and gentlemen, especially ladies, know what's normal for your body. You may be, used to some things and you think that it's normal, but it's not normal. They can be caused by something other than cancer, but the only way to know is to see your healthcare provider. And for those people who don't have a healthcare provider, there are entities such as the Tree of Life, who can take care of you. And so that's why this is such a beautiful marriage, because we all work together in taking care of our citizens here in the West Central Georgia area. What you should know about screenings. As I said, there are 2 screening tests that can help prevent cervical cancer or find it early. The Pap test or the Pap smear looks for precancers, cell changes on the cervix. The HPV test looks for the virus that can cause these cell tests. Both can be done in the doctor's office or a clinic. During the Pap test, as we said, the doctor's going to use that speculum that we ladies don't like to like to see. Yes, it's very uncomfortable, but that small uncomfortable feeling can save your life. And so this helps the doctor examine the vagina and the cervix, collect the cells and the mucus from the cervix and the area around it, and then the cells are sent to the laboratory, and then the results can come back. If you're getting a Pap test, the cells will be checked to see if they look normal. If you're getting an HPV test, the cells will be tested for HPV. When to get screened? If you're 21 to 29, you should start getting Paps at 21. If your Pap test result is normal, your doctor may tell you that you can wait 3 years until your next Pap test. However, we just try to again, go back to knowing and visiting your healthcare provider, and you and your healthcare provider making that decision. For those young ladies that may have become sexually active at an earlier age, they will need to discuss that with their pediatrician or with their primary care doctor. It's just so important to know what's normal, because we've had, when I first started here, a 15-year-old who passed away from cervical cancer. And so she had to have gotten it sooner. And so that's why we try to just tell you, make sure you talk with your care provider. If you're 30 to 65, these are some options here. If you're older than 65, the doctor may tell you don't need to be screened anymore. If you've had a normal screening test for several years, or if you've had your cervix removed as part of a total hysterectomy for non-cancerous conditions like fibroids. But I cannot stress it enough. See your healthcare provider. If you don't have a healthcare provider, we can help you get to those healthcare providers that are able to see people in town who are uninsured or underinsured. And when we say underinsured, it's if you have this high deductible and you can't afford to get the services you need. That's why we're here in regards to cancer screenings. It can take as long as 3 weeks to receive your test results. If your test shows that something might not be normal, your doctor's going to contact you and kind of figure out what's the best follow-up. If your test results show that they are not normal and may become cancer, your doctor will then let you know if you need to be treated. In most cases, treatment prevents cervical cancer from developing. And if your test results are normal, then your chance of getting cervical cancer in the next few years is low. We do have a great oncologist in town who treats cervical, uterine cancer, reproductive cancers with the St. Francis practice, and we work with him as well. And so if there's anyone who has that, they will be referred to Dr. Greg. How is it diagnosed and treated? Through surgery, through chemotherapy, and radiation. If your doctor says that you have cervical cancer, and as I said earlier, you will be referred to a gynecologic oncologist. That's a mouthful, gynecologic oncologist, and that's a doctor who's been trained to treat cancers of a woman's reproductive system. This doctor will work with you to create a treatment plan. And as I said, here in Columbus, we have a great gynecological oncologist, this is Dr. Greg. I don't want to butcher his last name, but it's Dr. Greg Spakianis, but he's with the St. Francis practice. The extent of the disease is referred to as a stage, and then information about all of that. But again, your gynecological oncologist will be discussing that with you. If they're in this area, if there are other places, then they will, find the resources for where they will need to be referred. As I said, the types of treatment can be treated in various ways. Surgery, where that cancer tissue is removed in an operation. Chemotherapy, special medicines to shrink or kill the cancer. The drugs can be pills. It can be done intravenously. Then there's radiation, using high energy rays to kill the cancer. Different treatments may be provided by different physicians on your medical team. But again, this is a personal journey, and so what your treatment is may be different than someone else's. And that's with all cancers. Gynecological oncologists have been trained, as I said, to treat cancers. Surgeons are doctors who perform operations. Medical oncologists are those doctors who treat cancer with medicine. Radiation oncologists are those doctors who treat cancer with radiation. And this information can also be seen at the National Cancer Institute's cervical cancer website. These are the resources that I've used for the presentation. You may pull the information up. You can go to American Cancer Society, the National Cervical Cancer Coalition, or the Centers for Disease Control. Now, the West Central Georgia Cancer Coalition, we have a Neighbors Helping Neighbors Cancer Assistance Fund. If you're diagnosed with cancer and you're in active treatment, then we're there to help provide those daily basic living expenses when life happens. When life happens, you're unable to work, or your work schedule has been reduced, your income has been reduced, your co-pays have increased. We're here to help with the lights, the gas, the mortgage, the transportation. If someone has problems getting back and forth for transportation, we have resources. We have a collaboration with the local cab company that will pick you up and drop you off. So we're just here to help be that missing link to get you to the services that you need. and that that a person is going through. And as Pop said earlier, when you hear the C word, the cancer word, sometimes you feel like it's a life, a death sentence, but it's not. Half of the battle is and Susan can attest to this, is mentally. It's what you are feeling mentally and getting the help that you need. If you're, a warrior and say, we're going to beat this, then that's half of the battle. And so we appreciate the opportunity to talk with you about the cancer, but I did want to share with you the information about our upcoming event that is called HPV Awareness. I'm going to share the screen. And can you see it?
Yes, we can.
Okay. On Thursday, January 21st, we say dinner time. We normally, due to the pandemic, we haven't been able to have our HPV mother-daughter tea. We normally have a mother-daughter tea where the girls and their moms come and we have someone to talk about HPV awareness in January. But due to the COVID, we have decided to collaborate with Georgia Families 360, Amerigroup, Three Rivers AHEC, and ourselves to have a webinar for mothers and daughters at dinner time from 6:30 to 7:30 to discuss HPV awareness. And our wonderful Dr. Katrina Strozier, with obstetrics and gynecological specialist, she will be presenting. She's with St. Francis OBGYN Physician Partners, and there's a link on here. They can click on the link to register. Everyone needs to be registered. We're going to have gift cards, and we're going to have fun. We're going to edutain the community during this time as well. On Thursday, January 21st, we ask you to please get registered. It's in the comfort of your home. It will be a private conversation that you can have or engage with your daughter or daughters or nieces or young ladies that you work with. Please get registered for this, and we ask for registration in advance for this particular event. And so we're excited about this event. We have it every year. This year is a webinar, and so we just want to make sure that the community knows about it. Thank you.
And Susan or Dr. Pitt, do you have any comments?
One
Just think
comment.
Go ahead.
Sorry.
Go ahead.
Well, one comment that I had was really just to say how important it is, as you mentioned, for parents to have the conversations with their children. One thing in particular is the fact that because the vaccine can start at such a young age, around 9 or 10 years old, for some parents, I think there is reluctance because you're introducing things regarding, of a sexual nature, and, for parents not wanting to bring this up so early. Yes. But it's important to stress that the HPV, the human papilloma virus, is not just through sexual contact. And parents have to understand that, you don't have to be sexually active to be in contact, because it is so contagious in that way. And so I can understand the reluctance of parents, not wanting to, kind of start this conversation with a 9-year-old, especially, a female who might not have even started menarche or having starting her menstrual cycles. Right. But again, the importance of having the conversation, letting them know that this is something that can occur without you even being in touch with, or having intercourse with a boy, And so that's just one of the things that I'm speaking of, about how important it is to have these conversations with young kids early on. And not that you're encouraging them in any way, but just to make certain that they are informed that, okay, it's not about going all the way, okay, with someone, right? Because it doesn't even take that. And it's important for that to be stressed. And so not that you're, bringing this up to encourage it in any way, but you want to make certain that they know well, I don't have to actually, have sex with someone. This is something that can occur. The second point to make is that I'd like to make is, knowing the symptoms, whether it is you're in pain. A lot of times you're not in pain, and that's the problem. A lot of times things can be further advanced because you let things go because you don't know. And so with HPV especially, or even just with female health, a lot of times people tend to cover things up. And so whether you have a discharge or not, or even certain odors that your body has. I mean, our bodies heal themselves, okay? And our bodies let us know what's going on. And there's a tendency to want to cover things up because let's say there might be an odor that a male or female might have. And so you're going to the stores buying perfumes and sprays and things to kind of mask an odor, but you don't do that. We don't encourage that. That odor is there for a reason. And it might not even be necessarily a bad odor, but just something that's different. And so it's important to, again, know your body. And so because of those certain discharges or odors, those are signs for us, people in the medical profession. It tells us a story. So we don't want you to go and cover things up and go, okay, well, it goes away. It smells better now. So no, as soon as you have a symptom like that, let your professional, healthcare professional know, so that the earlier, the better. And so those are just 2 points that, just kind of want to make. And again, we tend to want to cover things up, but certain things we don't cover up, right? That odor is there for a reason.
Absolutely.
And thank you.
Dr. Pitts, I was going to say in my former life, I was a health educator at the health department. And so I would go out and do a lot of the STD presentations and talking to teens and talking to adults. And, that was something that I would tell them all the time. That is not normal. That's why it is so important for you to know your body, what is normal, what is abnormal, or even if there's something that you think, I'm not sure about, that's still a sign. So, having that relationship with your healthcare provider, and as you said, with the parents, making sure that they're discussing along with the healthcare provider, the pediatrician, because this is truly a collaborative when we're discussing very sensitive topics such as this with children, with adults, and what have you. And so it's so important. And what you said, I co-sign 100%, on those things.
The other thing is, it's important to have a plan when you go to see your doctor. You may need to write down your list of symptoms so you don't forget. A lot of times when we do see our physician, we're only there in the room with them for 10, 15 minutes at the most. And it's kind of difficult to, you might get a little flustered, forget something. So it's a good idea to write that list of symptoms that you've been experiencing, not just around your gynecological health, but all your health symptoms, and know to talk to your physician. Have that conversation of courage with your physician also in those brief minutes when you do have him or her face to face.
That's absolutely.
And Dr. Pitts, to your point, it is very important. I'm glad that you touched on the subject of sitting down and having a conversation, because that's extremely, extremely important to not allow your own perceptions prevent you from having an honest conversation with your children. And that's one of the things that, as parents and grandparents and great-grandparents, you learned to have an open dialogue. But before you do that, don't limit the conversations, as you said, because that can be very injurious. And I'm so glad that you brought up that topic, that to sit down and to speak with the young ladies about a topic that is as serious as it is. And so thank you again for that observation, because it's very, very, very important. And the second one is, God made our body so intricate that it does tell us, as Cheryl was saying, know your body. So you know that if your body is exuding an odor that it shouldn't, or that is not, that's offensive to you, then don't mask it. You go and you see about it. And a lot of people are feel uncomfortable in having a dialogue like that, but that's, you opened the door for that, and it's very, very, very important for not just for parents, but for all of us to realize something like that. And now, Cheryl, let me tell you something I want to hit on, because you do so much. Talk to me some more about this Neighbors Helping Neighbors. And you were on my show, Focus on Health,
Yes.
where we did something where if you, on your license plate,
Yes.
is
Yes.
helping to pay. So I got a good memory for, what do you call it? I'm a septuagenarian now, right? Is that what they call me now? I'm a septuagenarian. Septuagenarians rock, we rock, we rock, we rock. So,
Well, yes, that Neighbors Helping Neighbors program just came out of a love for our community. I brought that to my board. Probably it's been 11 years ago now, because
Wow.
every year we have our Paint the Town Pink, and the monies raised from our Paint the Town Pink help infuse the Neighbors Helping Neighbors. But Neighbors Helping Neighbors is its own cancer assistance fund, and various fundraisers go into that fund to help cancer patients. It's called our Patient Assistance Account. And 11 years ago, there weren't any breast cancer awareness walks. There weren't any resources here in our community to help cancer patients when life happens.
Right.
You know, it was, it was heartbreaking for me. I had a loved one who since passed away. It was my father-in-law, and we were trying to find resources here, and we called various places, and they referred me to various places and said, well, you need to call this and you need to do this and so on. And I was a little frustrated. And out of my frustration came this ministry. It came this Cancer Assistance Fund, and my board has been just 100% supportive of it. And let me say, our community has been so supportive of this Cancer Assistance Fund, where we just sometimes, I go to the mailbox and there's a donation.
Awesome.
Someone's donated to, the organization to help with this, because thanking us for the work that we do. And it is, as I said, truly a ministry. This particular Cancer Assistance Fund, it's made through referrals through the various entities in town, through the John D. Ames Cancer Center, through St. Francis, through healthcare providers, through LaGrange, through Alabama, because we service Lee and Russell County as well. And so we get referrals from all over. And they, excuse me, there are certain requirements, but the main thing is you must be in active treatment, receiving radiation or chemotherapy, because the copays have increased, or what have you, your income has been reduced. But we help, as I said, with their lights, the gas, the mortgage, transportation assistance, anything to help reduce that burden of cancer when it happens. And this particular fund, there is an end. I'm putting it in the atmosphere. My goal is to have an endless amount of money in that Cancer Assistance Fund to help as many patients, as many clients as we can, because right now it's a one-time. If you receive funds once, then you can't come back again. And we know people have cancer twice, within a 3-year period. But because of our limited resources, and because of the number of people that are being, that are requesting the services, we just have to have some type of, requirements for that. But we do have a committee that meets. We present the case, share with what's happening. We have families who have children who have to travel, out of state. There have been families who both parents have had cancer at the same time. We get so many different types of cases or different types of stories here that I would love to help everyone, but due to the resources, or the limited resources that we have, we're unable to do that. But we have not turned anyone away. If they are referred here, we try our best to either get them a gift card. We were fortunate enough to be a recipient of the United Way COVID relief funds,
Right.
and we were able to help, cancer patients during that time with their mortgage, with their rent, because they were unable to work. Because as a cancer patient, during the very beginning of the pandemic, your treatment stopped. You could not go in to get treatment. And so people, it's like a trickle down effect where people are affected. And so this is, my eyes light up, because although it's dark, we try to provide light to people in those dark times. And so we are just here to help our community. We're here to hold their hand. I tell, newly diagnosed ladies or gentlemen, especially ladies who come in, I tell them, get you a journey journal. In that journal, you can write your questions down. You can write how you feel. You can write whatever you want to. And when you are through this process, then you can go back and read and see how awesome and what great, things that you went through. There were some dark days, but there's always some light at the end of the tunnel.
That's a good thing. But I want to make this comment about you. That you could, my grandmother used to always say, there's always something good that comes out of something bad. And one of my favorite scripture verses, I think it's Romans 38:42. And we know in all things that God works for the good of those who love him. Doesn't say just good things, but God is so omnipotent that even in bad things, the situation with your father-in-law, that you turned around. So this is a mission that is benefiting so many by the bad experience that you went through.
Oh, yeah.
Look at what has evolved from that. Now, now let me tell you something now. You gave me good information, but if somebody wants to write those checks and get some of that green paper with the presidents on it, how do they do that? Where do they send that, Cheryl?
They can send it to our address, 633 19th Street, Suite B as in boy, Columbus, Georgia, 31901. They can go on our website and click on donate. There's a donate button on there, wcgcc.org. They can drop it off. They can mail it in. We have not advanced to Cash App or anything like that, but they can donate through PayPal. We have PayPal available, so they can go on the website and donate. And as you said, there's money. And let me say this, Pop, I have a dream of having what we call a serenity room.
Yes.
And this is the room where we have, we're going to make it available for cancer patients who would like to come and just meditate or have a massage or what have you. There's someone trying to get in as I'm doing my presentation. I'm the only one here. I apologize. My fault.
That's okay. Don't worry.
The doors.
Now, Cheryl, let me ask you a question. So, and I always say this.
Yeah.
We have so many good people.
Yes.
Who live in this area here, and good-hearted. In fact, my last duty station was Fort Lewis, Washington. A lot of great folks out there.
Yes, sir.
But what drew my wife and I back here was the people in the South, or folks, F-O-L-K. Folks are good all over. But we had living here. We love this area here. And so we decided to come. And the people here in this area are giving people. So I will say, this is the West Central Georgia Cancer Coalition. You've seen all the marvelous things that this organization does. As I spoke about Tree of Life, also spoke about New Horizons Behavioral Health. These organizations cannot give good information, as Cheryl just gave out, without money and without volunteers. They are helping us, and we need to help them. The reason I asked Cheryl, when you were talking, I reached in my back pocket, and I don't do that PayPal pay because I'm bad on computers, but I'm a whiz at writing a check. And so the bottom line is that I want to know something like this is when a person is going through something physically, and cancer is something, although organizations like yours and research is not a death sentence, but people fail to realize that it's not only a health battle for a lot of people, it's an economic battle.
Oh, absolutely.
Oftentimes individuals cannot work. This doesn't stop the electric, water, gas, mortgage. So this Neighbors Helping Neighbors is a godsend. And you can only help if you're siloed. going back to Joseph in the Old Testament, if the silo's not full, you can't give us too much out.
Yeah.
And so the bottom line is that I will just encourage our good community, our good-hearted community here, to keep that organization, that fund, in a position where it can continue to do the good that it does. Also, Tree of Life Healthcare and New Horizons Behavior Health to be able to do. The Lord on the Mount told us, he didn't say it to just the ministers, he told all of us to feed the hungry, to clothe the naked. And so all of this is a part of it. And that's why I'm so thankful that the Lord has made possible for me to have this show here with the good organizations that come on here, because it's doing so much good in the community. And you want to know something that makes my heart feel good, makes Cheryl's heart feel good, Dr. Nikita Pitt's heart feel good, Dr. Laura Clyott, Susan Gallagher's, Andrea Winston's, everyone. When you get that good heart feeling, you cannot put a dollar value on it.
No.
You know you are doing something unselfishly for
Yeah.
others. It's just a God said. And I like to say to Miss Gwendolyn McIntosh, she said a nice message. Good morning, Gwendolyn. So to all of us here, I would like to say, as I always say, any final comments for Susan or Dr. Pitts or for Cheryl?
No. Thank you
No?
for the great work you do,
Thank
Cheryl.
you.
Yes,
Yes.
thank you.
Thank you.
I did, Pops,
Thank you.
want to just thank our community, our sponsors. In October, we did our Paint the Town Pink. It looked a little differently. However, people were still, we still had sponsors. And so I want to personally thank them and thank everyone who donated, who signed up to get a mask, to walk in their neighborhood. I just want to personally thank them for continuing to do the great work that they do and to help us continue to help reduce the burden of cancer in the communities that we serve, because we are truly neighbors helping neighbors.
Yes. And I just love, with a capital L, capital O, capital V, capital E, this community. And so I always end Facebook Friends and Family with this here. Please be good and kind to yourself, because God loves you. See you, not next Monday because it's a holiday, but we'll see you the Monday afterwards. I think that's the 25th. And I think Dr. Pitts will do it on sickle cell. So
Yes.
Pop,
until then,
my mom told me to tell you hello from Atlanta. My son.
oh yes,
He said,
that marvelous son of yours. I just love that son of yours and seeing the interaction between you. You tell your son I got him on for June now.
all right, we got it.
Tell him, don't forget. He has
Thank
plenty
you.
of time to do his PowerPoint presentation. God bless you all. Take care now. If I can log
Bye,
out of here
everybody.
Bye.
successfully somehow. There we go. That's that old button that I hit before.